A little bit about how I got into peptide therapy. Essentially, peptides changed my life. I progressively became increasingly ill during medical school and residency. I was barely able to function with profound fatigue, anxiety, insomnia, cognitive problems, panic attacks, inability to handle stress. I was really wiped out with any physical or mental stress. I went to every specialist that you could think of without benefit. Standard tests were revealed nothing, they were all normal, and nothing seemed to help. I was and am an ardent follower of being an evidence-based physician. I take pride in that. But it's ingrained in students and residents that anything taught outside of the university that doesn't conform to the standard medical dogma is quackery. Thus, I really delayed looking for therapies that weren't considered to be so-called standard of care. However, had to do something different because I couldn't function and no one was helping me. So I really went off and snuck off, didn't tell anyone, and went to tons of so-called integrative, alternative, functional medicine. I was blown away that most of these conferences were more evidence-based and years ahead of what standard medicine and what they were teaching in medical school and residency. Again, so the opposite was true. These so-called alternative, integrative, functional medicine were more evidence-based than the way you're taught in universities in the old dogma that's being taught when you're resident. And the problem is all these standard dogma societal guidelines basically don't change for 20 years. But it was so exciting to me because new therapies were coming out all the time, with literature reviews, new evidence coming out. It was a new way to practice medicine, and I really embraced it. Was very excited about it. And the thing was, in standard medicine was moving so slow, while so-called alternative medicine, which I was always told means no evidence. Now, I mean, it's the opposite, I think. And people ask, what kind of medicine do you do? I think we do standard medicine, just better. So after spending a year of investigating potentially beneficial therapeutics for my condition, I implemented a multi-system therapeutic regimen that resolved most of my severe symptoms and was able to go back to work. I felt like a new person, and with many innovative, again, multi-system treatments, including immune modulators and hormone optimization, despite my labs being so-called normal. Straight T3, which is a passion of mine. We started the National Academy of Hypothyroidism, a nonprofit, really was a key component of changing my life. So thyroid optimization with T3 was hugely beneficial, but a lot of other treatments were certainly beneficial as well. But what happened is subsequently I went through a stressful divorce, which resulted in just a huge flare. And I often lecture on how stress is a major player in the perpetuation of chronic illness. And it left me mostly bedbound for months with severe fatigue, anxiety, and panic attacks were worse, just drenching sweat, severe sleep disorder, never slept, again, profuse sweating, neuropathies, really complete inability to handle stress. The phone would ring and I would just jump out of my skin. I had allodynia, which people couldn't touch my skin. I couldn't have a blood pressure cuff, and just had a ton of symptoms. And then I went into heart failure and intermittent AFib. I couldn't stand upright. I couldn't walk upstairs. I developed autoimmune kidney disease, antiphospholipid syndrome. I knew I had a chronic infection, likely Lyme disease, but my blood was so thick from immune activation of coagulation that you could not even draw it out when I was on high dose anticoagulants with the most massive needle. It was just like syrup. Ultimately, the Lyme disease tests came back, were confirmed. with specialty testing. The standard tests were negative until I fixed my immune system, and then they all turned positive. I also had Babesia, which is probably the worst bug to get, and Bartonella, causing all that anxiety and cognitive dysfunction, and lots of reacting viruses and mold toxicity. So I had the whole gambit, and I also believe that I got it basically from birth. So I knew I was going to be one of the toughest patients, and it wasn't going to be an easy fix. I tried massive doses of antibiotics, doing 4, 7 intravenous antibiotics at the same time at many times the maximal dose. These are doses I would never give to a patient due to the risk, but I still was no better after 4.5 years of doing this intense therapy. My immune system was so bad, so my natural killer cell function, which is the cell that monitors your body for intracellular infections and also cancer, was basically non-existent. It ran between 0 and 3, normal is above 30, which is why the antibiotics never worked. You can't take enough antibiotics to kill a bug. You have to have an immune system to take over. But with no immune system, you can just take antibiotics till the cows come home and they won't work. I remember being in the ICU with sepsis, so blood infection, and the nurses outside, I could hear them through the little drape. They said, "Oh, this is the AIDS patient that keeps coming up negative on HIV, negative for HIV." Well, I knew what it was, but I had so many HIV tests, but of course they're all negative. The infectious disease doctors were very disinterested. They flat out told me that they don't believe in chronic Lyme disease, chronic fatigue syndrome, fibromyalgia, and they refused to address any issue other than the acute infection. I said, "Okay, to get rid of all that, just tell me what I have." But no, they weren't interested. And that's what we find, unfortunately. I was discharged and decided that I really had to do something. I had to make a choice. So I decided to really go around the country, around the world, to find new therapies that could potentially help this condition that I really could not live with, especially when you have anxiety and the fatigue and then heart failure on top of that. I had to do something. I couldn't continue. And I really don't think people understand how bad someone feels with chronic Lyme and other these chronic infections. It's more horrible than I think someone could ever imagine who hasn't had it and they can't truly understand. Even though I felt so horrible and struggled to walk, I remember trying to make a plane flight, just walking, just sweating, half bent over, just having a constant panic attack, and just was ready to give up so many times. And oh my God, if there were stairs, it was horrible. Sitting in the plane seat, just profusely sweating, everyone looking at me. So it was an adventure. But I went really anywhere where I heard someone who had good evidence and were getting people better with these complex illnesses, chronic Lyme and Sears, and went around the country and around the world. I really felt I had no choice. I knew the infections were killing me. While many treatments were somewhat helpful, no doubt, I still struggled to get out of bed every day, and I remained in heart failure. My cardiologist said that he expects that due to the damage to the heart, I might get 10% better in about 10 years with aggressive physical therapy. And that is just very depressing. And then while in Europe, I had a life-changing event. I discovered peptides, which I'd never heard of at the time, but they ended up saving my life. After hundreds of different treatments with marginal benefits, including, again, the 4.5 years of IV antibiotics, I was still severely disabled. However, after being on peptides for just a few weeks, I felt something was changing. And by 6 months, I'm a different person. And to the astonishment of my cardiologist, I walked into his office upright and then was shown to have a normal echo. Less than a year later, again, he said I would only improve 10% in 10 years. He said he'd never seen such a recovery. And I also found a number of therapies that were very synergistic, which we find with peptides. So a lot of things work like with peptides, so they make other therapies work even better, including other peptides and also T3, ozone, stem cells, exosomes, any immune modulators, mitochondrial boosters. So again, this is a tool to put in your toolbox, but it's a major tool. It's your go-to guy. Problem was, peptides were not available in the U.S., so I could not prescribe them to my patients, even though they'd saved my life and had no side effects due to the FDA regulations of using products made outside the U.S., be it Europe or elsewhere. Despite the fact it killed me because I knew it would help so many of my patients that were just really struggling. And then one day at a conference, and I was still going to just tons of conferences, lo and behold, there's a compounding pharmacy that was making injectable and oral peptides for use in the U.S. I became their first physician speaker. I've lectured at numerous conferences and trained physicians on the use of peptides. And, I just, they helped me so much. I was like so excited to share my newfound knowledge. Peptides quickly became the core treatment for the physicians in our centers. At one point, we had 22 centers around the country and then 9 franchises. And the doctors that embraced peptides had by far the best outcomes of any other doctors that didn't have this tool. They were dramatically able to improve outcomes that we tracked, and we've actually published our outcomes showing that people saw, we did actually the first 500 patients that had seen on average 7.2 physicians without any improvement. And then by the 4th visit, almost 90% got significantly better, and about 65% really dramatically better by the 4th visit after not having any luck with 7.2 physicians. Now I think it's about 15 physicians they see before seeing us. And also the nice thing is we're able to drastically reduce the use of many standard therapies that are often ineffective or have significant side effects. I remember one doctor, the first time, and who also spoke for us, it was early on, Dr. Tringali saw me at a conference, and she was just so excited. She basically came to me and said, "Oh my gosh, BPC 157, it makes everything work better." And those things that you just really remember because it's true. It just can help so many different patients.